in October, we wear pink. Yay! And for this episode, we're talking women's health, of course, with a focus on breast cancer awareness because it is October, but health overall. And I think as you get older, our health changes and the things we do. And one of the things that I've started doing, and I know a lot of you and women have asked me, actually, this was a request, was supplements and what we do as we've aged to stay healthier, not just on the outside, but on the inside as well. I know I take a lot of supplements. I even asked Marilena the other day, like, what do you take? Because I'm always curious to see what things people do natural to stay healthy. Okay, so first and foremost, whoever wants to start, how has it changed for you as you've gotten older as far as your health and what you do to stay healthy? Which one of you? Take it away.
Okay.
Marilena.
I mean, I always say exercise is the best medicine.
Yeah.
So exercise a plus. It give you energy, it give you endurance, it make you healthier. That's the number one advice. Number two, your supplements. And number three, your preventive care.
Yeah. Preventive care is what? Just so for those who don't know when we talk about that.
I mean, depending on your age group, there's, you have to have an annual every year and make sure that you, after age 18, you should do that. Make sure that you check your blood and they check for your basically thyroid, cholesterol, liver enzymes, kidney function, anemia. Like once a year you have to do that. And then depending on your age group, then start getting more complex.
Yes, and the mammograms too, which is important. One of the things when I was on the news, when we were still doing hard news, I did a couple of stories on breast cancer awareness. This is something I didn't know. Early detection is key because by the time you actually feel a lump, it's already advanced.
Exactly.
And it's one of the more treatable cancers. So if you catch it early, the survival rate is over 90%.
Oh, really?
Mm-hmm. So that's 5 years. Yeah.
Early detection is super important.
When should women start getting a mammogram?
Well, prior to August of 24, it was actually recommended per the patient up to age 45 or 50, like they could make their decision on their own. But the recommendation has changed to now 40, and that's what I've always really done. So 40 is when I start recommending mammograms.
Of course, depending on the family history.
Mm-hmm.
Okay.
If you have family history of breast cancer at a young age, you have to start earlier.
And what about, is it every year after that you do it? Okay.
I do them every year. The recommendation is every other, but for me and my patients, I do them every year.
Every year, and also the self-exam. I know that sounds like
What is a self-exam when we talk about, hey, you have to do your self-exam? What is it? What are you supposed to do?
Basically, you have to check your breast, and you shouldn't do it right before your period because the gland is going to be inflamed. But you have to check your breast quarter by quarter under the nipple and in your axilla. In both breasts, and you should do it once a month.
Really?
And a lot of people who have had breast cancer, at least in my practice, have had some inclination physically that they've had it. So they've had a pain that's not normal. They've had something that clued them into something was not exactly right. Not everybody.
Like what? Give me examples.
Mostly it's pain.
Pain in the breast area?
Mm-hmm. Mostly it's pain.
And also there is, breast cancer usually is a lump. Like you find a lump, but there is a different type of breast cancer. The most common is the one that present like a lump, but there is also what they call inflammatory breast cancer, and it looks like you have an infection in the skin. And actually, in the mammogram, you might not see it. And that's what they call inflammatory breast cancer. And it looks like basically like a cellulitis. Cellulitis is like an infection of the skin, and it's hard to diagnose.
Oh, really?
And the other one that is kind of like not very common is the Paget disease. But Paget disease is a bone disease. But then Paget in the breast is like starting the nipple, and the nipple start like.
It changes texture almost to like an orange peel. That's how they describe it. So the texture just changes from soft to kind of leathery and
Just
bumpy.
in the nipple.
It can happen more in the nipple, but it can spread out depending on.
Anytime you see
severity.
anything abnormal in your skin or you're feeling, for sure get it checked out.
Yeah, exactly. Especially inverted,
Inverted nipples where they weren't like that before.
Oh, okay.
And some
change
people
on the
have had that forever.
skin.
But
Okay.
I mean, it's not just a lump. It's just
It's
like
there's a lot of things. Always, what about? I mean, trusting your intuition, because we know, we know when there's something wrong with us, and I almost feel like we talk ourselves out of no, I'm fine, I'm fine. But it's like just get it checked out and find out it's not. I mean, the mammogram isn't as bad as people make it out.
No, and
it's quick. It's
I'm surprised how many people use that as their reasoning for not wanting to get one is the discomfort. And my response to that is 2 minutes of discomfort is hardly worth the discomfort of a breast cancer
absolutely
treatment,
It's not
surgery,
that bad.
radiation.
It's not that bad. Now, for breast implants, there's this misconception that you can't get a mammogram when you have breast implants. True or not true?
no.
Not true.
Not true. I know I've had mammograms. Yeah.
Basically, you have to do 4 extra views because basically they do the mammogram, just the whole breast, and then they actually pull the skin just
They
to
move the
check the. So you have to have 4
Yeah.
4 extra views, but
It's not bad. It's not as bad as people make it out. You're right. What's worse, having
Right.
breast cancer? What about the other type of exams that we do with the women's? Your pap smears, which I think if there's a checkup it's the pap smear. And Jen's my OBGYN, but sitting there with your, that's probably but you're quick.
I'm quick.
Jen's quick.
it should be quick.
It should be quick. You don't
It
have
is quick.
You don't have to
it
linger
shouldn't
around
be
in there, just-
painful. It's just like, look, in
How do
El
you
Paso.
say it? How do you call
In
it?
What did you say?
Panocholo. It's okay. It's on YouTube. Nobody knows. Okay, keep going.
But in El Paso, I mean, since I moved to El Paso and I started practicing, and it's been 22 years, I just seen, due to the pap smear doing yearly, especially in young women that have different partners, I seen just 3 cases of cervix cancer.
Really?
Yes.
Is that a lot or not a lot? I don't
No,
know.
Not a
that's-
lot considering in 22 years.
Okay.
No.
I've seen a little bit more, but that's
But
just
you're an
probably-
OBGYN.
Yeah, so I see that. I mean, on a more regular basis, but there's still quite a prevalence of it in our age group. So we didn't have the vaccinations when we were young. So I would say the 40 and over crowd still comes in with a lot of cervical abnormalities referred from other physicians.
Okay.
Are there symptoms that patients feel when they get cervix cancer? No.
No, even with breast cancer. I mean, for me, in my practice, breast cancer is more like an incidental finding. Like, especially, like they find a little calcification and it's very treatable. I mean, and the 5-year survival rate is like 90%.
It's pretty high.
And then also right now you mentioned vaccine, which is something fairly new.
It's been around for quite a while. Yeah, they've improved it since the time it first came out to include more HPV strains. But the ones that are most responsible for cervical cancer are included in that vaccination.
And what is it human papilloma?
Human papillomavirus. Yes.
So how can somebody get human papilloma?
It's
virus?
usually, if not always, sexually transmitted.
Okay.
But not always.
Not always, but
Most common.
a fair amount of the time it's sexually transmitted through one way or another.
How old do children have to be? Is it a vaccine for
9 years
men
old.
and women?
Yes.
It is
Boys and
now.
girls?
Yes.
It is now. So men
Really?
have no symptoms. They don't get pap smears, obviously. They don't really get any checkup for HPV, so
Wow.
they're silent carriers.
Wow.
And so in treating boys when they're young, hopefully prevents the transmission to females as we age.
Wow. Wow. I didn't know all of
treating
this.
the-
But men can get symptomatic too.
They can.
They can
What
get
are the symptoms?
Warts.
No.
I mean, it's like, wow.
But
And what type of treatments are there for somebody that's diagnosed with HPV?
I don't treat men, so on the female part, about 70% of low-grade abnormalities resolve on their own. So a lot of times we just do observation. Sometimes we do freezing if they want a more aggressive treatment, laser, or if it's a big abnormality, we actually take a bigger piece of the cervix out. And
Yikes.
warts, we can also do freezing or acid treatments. That typical type of HPV, though, doesn't cause cancer per se, very frequently.
So if it's treated just watching it with time, is it harmful to patients that do get it?
No, I would say in our patient population, a good 80% or more of us have been exposed to HPV at one point or another. So it's very common. It lays asleep in the body sometimes 10, 15, 20 years. You never really know when you were exposed to it. I just happen to catch it when I do the pap smear. And so it just happens to be awake for whatever reason at that moment, and that's when we usually recommend other treatments.
Is that also something you test for in the pap smear? Mm-hmm. Okay, so all of that will come back if there's that's abnormality and stuff.
I mean, if you see like a pap smear that is abnormal, then you do an HPV. I don't do it.
I do it always on women over 30.
How young should you start getting pap smears?
The recommendation is 21 and above if you're sexually active.
Okay, so there you go. For everyone and anyone watching this, it's important. What other, like your preventative exams or checkups should we be doing when we talk about women's health? What do you guys recommend?
Well, I mean, coming into the
big
yearly
ones.
exam is always important. Like Maria Elena said, if there's skin changes or dimpling or something, especially when you see patients year after year after year, you get to know them. And so it's important to lay eyes on the abnormality or have people come in so that a more professional person can take a look at what they're.
I have a big question, and I didn't realize it, but I see it anytime I'm on TikTok or Instagram or any one of those. There's all these commercials for women's hair loss during menopause. And I'm thinking, is that a symptom, losing your hair? And then I realized my hair was thinning out, and I started I've never really, and I'm like,
Yes,
right?
and it's a big.
It's a big thing. So
big-
what can you do? Because I started.
And patients are, like some patients are kind of like embarrassed to us, but I immediately address it. I mean, I see that your hair
There's a little
is
thing.
yeah, and you can. I mean, basically, I prescribe medication immediately.
I think you told me, and I was like, huh. But now I saw, yes, I think, because you don't see it in the mirror, but you see yourself in a picture, and I was like, why do I have a spot here? And I guess it just
No, a
happens.
spot is different. I mean, it's thinning.
No, it's
Menopause is
thinning,
thinning,
but
but
you
it's
could see your
like-
scalp. You could see your
Yeah,
scalp
but
from your hair.
spot is alopecia.
No, I don't
But
think.
this is more like breaking
Thinning,
and
yeah.
just kind
Yeah,
of.
I've noticed that. I've noticed that. Like
Your hair
that
won't grow
thinning.
back
Yes,
as
I
long.
used
yes.
to have a lot of hair,
Me
and it was
too.
very thick.
Yes, when
And
I
now
was small, like I
suddenly-
used to have hair you could braid
Yes,
for days, and now
like like the rubber band would
Yeah,
only go twice,
twice.
and now it's like
Yes.
5 times. Yeah, definitely.
And the ponytails get.
skinnier,
Super
skinny,
skinny.
skinny.
Yes, absolutely.
Do the supplements help? The vitamins and Nutrafol, they do help.
And the medication help too.
Yeah, but do you grow hair in other places? I've heard horror stories where you start to grow a mustache and a beard, and so that's why I didn't want to take it. But now I want to take it.
baby. There's laser.
Oh, and then it won't grow on your face, or you
yeah,
get
you
like.
just do the laser.
That's a good question. So if you take the medication to grow thicker or more hair,
It sale
it
cabello
doesn't-
everywhere.
No,
So you get it everywhere?
Depending on what medication. I mean, you
Okay.
can do finasteride, dutasteride.
What's a light one? What would you recommend?
Spironolactone.
and then is it a pill?
But
a
yes,
pill.
but
Okay.
minoxidil, that is a big one, is the one that make you grow hair everywhere. But like if you're not hairy, it's not gonna
I'm
be
not
like,
hairy.
So don't worry. You're not
As you walk
hairy.
in,
no,
as you walk in, on the next show, if I have a mustache, you guys will know why.
Barbarossa.
I'm like, wow, that 5 o'clock shadow is really looking.
But look at my hair; it's so much thicker.
You have hair for days.
No, okay, so you may have to write this whole prescription. One of you, like, because I noticed it, and then I'm like, I feel like the universe is talking to me, like my hair's
And
thinning out.
even the eyebrows,
Yes.
the
Mhm.
lashes,
They
they
thin out.
start
Everything
to like.
starts thinning, and it doesn't grow back as quick as it used to.
Damn.
It's okay.
But it's listen, I'm okay with getting older. I mean, I'm fighting it every step of the way.
Me too.
Every step
Likewise,
of the
I
way,
think we
yeah.
all are.
We're aging backwards, but I'm okay with getting. I mean, I'm okay saying goodbye to a period. Seriously, like I've been there, done that. Let's close that fucking door. Done. The baby factory has shut down.
But long time ago.
Not that long.
Well, not that. No, there was like a time I thought I was pregnant, and she was like, "I think you're just menopausing." So it turns out, if you're in your 40s, although you can still get pregnant, right?
You can.
Yes, of course.
Definitely.
There you go. But
What is the oldest patient you've seen getting pregnant?
In my practice, I think 51, 52.
oh, I would
Oh,
die.
it's not that old.
Well, no,
I've
it's not-
met
Older?
50s in their 50s that have gotten like
Pregnant?
suddenly like, hey, I'm pregnant. And
But
you're
could
like,
you
oh,
imagine? Okay, let me take you there. Can you imagine getting pregnant and having a baby right now at this age?
No.
She looked horrified.
Look at my look at it. Like starting over.
No.
Carrying a diaper bag?
Yes.
To be honest, I don't mind when they're little.
No.
When they're little, when they
They're
start,
cute.
I mean, once they get to middle school,
You're like, yeah.
and as they get older, it's worse and worse. I mean, like
I'm getting there, so don't scare
Oh,
me.
girl.
You're entering the middle school era.
like,
to me, the first
little
year
child,
was hard.
little
Yeah.
problem. Big child,
That's right.
big
problem.
That's right. Middle school, no, not middle school. Baby, the first year, because I had a baby at 21. I was so young, but not sleeping, the getting up every 3 hours
that's
and
Yes. And when they get sick, it's hard.
when they get sick.
Yes.
At this
There's a
age,
lot
can
of-
you imagine doing that? No. No. Let's
I
take
did it at work.
How old were you when you had your baby?
38.
Okay, that's a good age.
I was 38 too.
Oh, you were 38 too?
I was 33.
I see.
But I dragged that child with me everywhere.
I was 21.
To round, to everything.
How's it different from?
No, I was 36.
You were 36. I was 21. 21 is young. I wasn't dumb. Like you're just young.
No, but now
Now it's
you're-
amazing.
now you
amazing.
have-
Yeah.
Your sons.
Yeah.
You, know,
You get to see
to
him as
do
an
a lot
adult
of fun
and-
stuff with him.
Yeah, it's like a lesson in growing up. Like you think a baby's gonna be and no, it's like it was. You have to grow up, but it's a blessing. Of course, it's always a blessing, no matter what age. You know, children are blessings. They are blessings,
The
and
best things happen when you're not ready for them.
That's
you
right.
Just kind of
I don't think you're
level
ever-
up.
You're never ready. You think you guys were ready? And
Oh,
you're
I was super
doctors. You were
ready.
already
I was ready.
doctors. You were ready.
I was super
I was ready because I had put my career first and then had child
You
later.
were ready too. You did too. All three of you did.
I think I was ready, but it's still not the fact that mentally you think you're ready. I
Yeah.
don't think it's like better than having it when you're
Yeah.
younger.
Right.
Because
It's
a
still not,
surprise.
even though we're doctors. I mean, I
don't
didn't know how to put
know.
on a diaper. I was like,
Exactly.
like I was like
Yeah.
total fail. So I
Yes.
mean,
He's crying or
Yeah.
she's crying. Well, no.
I picked him at night and I like looked and my hand was full of poop because I didn't put the diaper on. Right? And I was like, I'm done.
Yeah, I mean, like it's still a
Like,
shock,
you
right?
Still don't, yeah, you still don't know
the funnest-
anything.
The funnest and funniest when they're boys, and you're gonna change a diaper. And
Oh,
you're
and
gonna
then
do it quick enough, and
That's
suddenly
right.
They're,
That cold breeze gets them, and you get a stream of pee. You didn't get that.
it's holy water though.
It's holy water. Yeah. Well, and then
thorough.
you stick.
Well,
to
I mean, I'm a pediatrician. It's
oh,
just
that's
a minute.
right.
I'm sure
so
she
you
gets
were
I get
ready
the
more than we
golden
do.
shower.
the golden shower. Yeah. So you weren't as shocked, like when you transitioned from, and you were already. You did pediatrics, so
Yeah.
it wasn't.
It was easy. I mean, it wasn't easy, of course. I mean, long nights. My daughter was jaundice, and she had to sleep in a box and light box, and then I had to go to work when she was 2 weeks old. So the breastfeeding. But I mean, she came with me. It was my office. I have a nursery for her. You remember,
Same.
like me in
Yeah.
the stroller, But for me, it was a blessing.
Of
It
course.
changed my life
Of
for the.
course. Yeah. No, I feel.
Especially for me, I have a hard time getting pregnant. So my daughter was an in vitro baby, but I got her the first time. I
Good
did
for
it.
you.
So
She's they're always blessings. Yeah, no, I look back and I think at 21 it was the right time because he made me grow up and I learned a lot.
Yeah, maybe you would have been on a train wreck somewhere else had you been.
Absolutely, and I always think that having a baby, we're selfish human beings. We see things from the self, and then being a parent really forces you to love someone more than you love yourself. You will love someone. I mean, you will give your life for this person. It's a
Exactly.
different kind of love. Then you can tell somebody this until they experience it. They don't know.
Exactly.
Right? And you guys know because we're moms.
I don't know
yeah.
if that happened to you, but when I had my baby, I remember that I became so paranoid that I would be like holding her, and I was going down the stairs. I would see like the baby rolling.
Yeah. All these
So,
irrational
like
fears,
bad.
for sure.
Yeah.
You get all these irrational fears that because all of a sudden your mother bear comes out, like instinct to protect. And it never go.
Are they breathing?
Yeah, I'm gonna tell you because we all have kids at different stages. Like you have
Yeah.
one in college, and hers is high school about to graduate, and then you have middle school, and I have a 29-year-old. It never goes away. I'm gonna tell you, even when they're adults, your instinct to protect and love. It's like I still see my son like a 5-year-old,
Same.
and he has to tell me, Mom, and he's a man, but you understand your parents better. It's such a good cycle. I don't know. What do you all think?
I agree 100%. Funny story, we were at a restaurant and I didn't realize that the waitress and him were flirting and I thought she was being rude to him. And so I was like, what is is your problem? And she's like, it was
When did you
hilarious.
figure out that?
Well, after I was like, you messed up my game, Mom, and I was like, oh, I didn't realize that was a thing. Sorry. But she was so really. She slammed the plate on the floor.
She's
and I was
trying
like,
to
what
get
are
his
you
attention.
doing? I was like, that's not how you serve something.
She's flirting. Oh my God, that is so funny.
Yes.
Yeah.
So let's talk now that we transition from women's health
Oh, yeah.
and then our kids. And being that I have the youngest one, how do you convey that message about being careful with their own personal health and start talking about be careful? You know, you're going to start dating.
Yes.
I do it in my practice all the time. I mean, basically,
How early
teenagers.
should we start talking to our children about?
I guess because of what we do, it was very common amongst our household conversations. But safe sex practices, infections that can and cannot be treated have always been a big part of our conversation.
How early?
Gosh, I would say maybe
12,
11 or
13.
12.
I started early with William too.
And not full blown,
At their
12,
level.
13, and
Yeah.
then when they start like birth control, the girls, I say, this will prevent you not to have babies,
but not STDs.
but no STDs.
Yes.
So,
And not everything can be treated, so.
With William, I never wanted him to feel shame about
remember you
sexuality or
said
his
that. You were
body.
good.
I don't ever want to shame him because it's something that God gives you, your sexuality. So I wanted to make it okay for him to come talk to me about anything. Because my mom I love my mom, but the Mexicana, you guys know Latina moms and so I think 12, 13,
Difficult
same kind of
subject.
thing.
Yeah,
It's that
yeah.
typical. Yeah, you don't.
we didn't learn in the internet. We didn't learn.
No,
we
no,
just
we didn't
learned
have all
about-
that. We just
We
had what
learned
had.
from our friends, and what do our friends know?
Absolutely, yeah.
So
And he's always been very comfortable coming to me
Yeah.
with his friends' problems.
yeah.
So as a freshman, he came. He's like, "Mom, there's this girl in my class, and she hasn't had a period in 4 months, and I felt her belly, and it's hard." I'm like, "Is it yours?" And so he was like, "No." So I was like, "Okay, continue." So he's very comfortable coming to me with these other problems.
And
or-
she wasn't pregnant for the record.
No, she
for the
wasn't.
we're not giving anything. Yeah.
Not at all. But when his
Constipation.
female friends have problems, he'll come to me and he's like, "Can you see her?" So it's just common for us
Yeah.
to have those conversations.
I've with William, I mean, he's a grown man now, and he's sometimes has told me to butt out. I had to watch the Mexican meddling mom. But when there's things that I want to give advice, I just have learned how to do it more because he's not a little boy anymore. I have really had to learn how to do peer to peer. Like he's a grown man. Listen, son, can I give you some advice? If he doesn't want to hear it, then I have to respect it because I don't support him. He's financially on his own. But there's things that he's really, I have such a good relationship with him that he's open and receptive about health or exercising. He stopped drinking. And that was mine and my husband's influence. So there's, I think that starts like at young age where you have those open relationships with your kids. And but I'm grateful that I have like you guys have great relationships with your kids.
And they learn. They learn if you're
learn,
going to fly
yeah.
off the handle when they're telling
Yeah.
you something, then they're
Yeah,
not going to
that's
come to you
true.
with the next issue. So you just really have to be.
I've flown off the handle and
Same.
then I have to come back and be like, I'm sorry I flew off the handle. I love you, but
Well, I'm sure it's a natural
Yeah.
stage,
Yes.
a natural thing to do when you hear
protect.
something. Of course, But like you said, well, then you come back and you're like, I'm sorry. Like, let's talk about this again.
In a rational way. Like, that's not.
Yes.
yes, it's the best. The motherhood is, I know there's the love, el amor.
I
What
know,
about
but
you?
We have to give the message and this
Say
the episode that women have to have a mammogram
They do.
Yes.
and some of them ultrasound every year.
Tell us
I
it.
mean, you diagnose breast cancer with a little calcification, you're gonna be cancer free for the rest of your life.
Oh, really?
Yeah, cancer free for the rest of your life.
That's so important. Okay, Maria Elena, so tell us, as early, what's the difference from catching it, like you said, super early
stage
to
1 or stage 4. I mean, the survival rate is
The survival, the treatment.
95%. They can live 20 years and they can be cured. But they have to catch it at early age. It's a very curable cancer. The
Very
same that
curable.
prostate cancer. Very curable, but you have to be responsible with your body.
That's
I always
right.
say, you take your car for inspection. You renew the sticker. You take your car to get service. This body, this vehicle, you cannot
There's
change
only
it.
one of
That's
them.
right.
You cannot change it.
That's right.
So you have to do maintenance. And it's very important And if you have breast that is very dense, you have to do ultrasound and sometimes MRI as well.
I have a question. I've known a few friends that have gone through this. What Angelina Jolie went through. Can you explain to us a little bit about that, please?
Yeah, it's the BRCA1 or BRCA2. It's a gene.
And it has a higher incidence of breast and ovarian cancer. So depending on the positivity and your age and your childbearing at that time, different recommendations are given. Most the literature says to be done with childbearing by age 35 so that you can take other preventative measures, such as a mastectomy and sometimes an ovarian removal as well.
Yeah,
How do you detect that?
by blood.
Through blood. And so we don't check everybody. It's an expensive test, but when you come and you have a family history, there's criteria or checklists that we kind of go through. And so if you meet that criteria, then it would be advisable to do that.
And actually, there is kind of like a screening test, like that DNA test that they do for like see what is your ancestry.
Oh yeah, like 23andMe.
They have it for a BRCA1
Okay.
and 2, but just like a screening test.
Yeah.
Because as she mentioned, it's very expensive, and this is kind of like it's not very accurate, but
Yeah.
at least it
It
can
I'm
gives
not
give
you
you.
familiar with that.
Yeah.
Are those tests covered by insurance?
With the proper family history, so there is some legwork to be done, and the companies are really, really good about, at least in my experience, helping the patients out where they can and trying to get those things covered. They do offer pretty reasonable self-pay pricing though. And so for the most part, if you have that family history that warrants the test to be done, they do, but it's sometimes a struggle a little bit.
Are there things that people can do naturally to keep cancer away, especially the cancers that target women? Breast cancers, like, now we know smoking can exacerbate it.
Smoking,
Alcohol too.
Alcohol, high sugar, it's thought to be inflammatory.
Obesity.
Obesity.
And believe it or not, tall
me.
women get more breast cancer.
Really? Why is that? It's something in the genes?
And United States,
What makes you risk? What are the big risks? Like you said, drinking, smoking, sugar.
early
Ever-
age periods. I mean, when with the
Late
and then
menopause.
also when you don't have children, when you don't breastfeed.
So the thought process in that is that the estrogen production is never paused. And so if you've never had children, you have an early menses when you start having periods. If you have a late menopause, those are years and years and years of exposure to estrogen.
What is a late menopause? Late 50s, mid 50s?
Average age is about 51. And
Okay.
so beyond that, I mean, not everyone reads the textbook. Some people 40, some people a little later. So
And also hormone replacement after age 60 for more than 5 years, especially with double agent, meaning estrogen and progesterone.
progesterone.
There's and men can also get breast cancer.
Yeah,
right?
yeah,
I
yeah,
was
yeah.
reading that
Yeah.
that one of the higher incidences in African American are non-Hispanic males. I'm not familiar
Really?
with that because I don't treat them. But have you seen
Wow.
that ever? Male breast cancer.
I've seen it in the breast cancer parties that they do and the men come.
Really?
But it's very aggressive.
Yeah.
For men, it is.
Very
Yeah,
aggressive.
very aggressive. By the time, because I don't think men really think about that as a
They didn't check.
possibility. They don't
Yes.
check. They don't get their exams. They rarely go to a doctor.
But it can be aggressive.
That's what
Very
I was
aggressive,
reading.
yes.
I was not familiar with that.
Very interesting.
That's interesting. Yeah. Any parting? We got to wrap it up shortly. But anything else that you want to recommend? And I love the point that you said, like, get checked, get screened, get your tests. Oh, it can a blood exam, like if you do the blood that checks for everything. Sometimes when our blood panels are off, was that an indication that
No.
No.
But one thing I want to say is that now the insurance, they say, well, you have to check until age 74. But actually, the lifespan
Has increased so much. I don't
so
stop
I'm
at
like,
74.
I see ladies that are 80, but they're super healthy.
Oh,
They don't need a walker. They don't need anything.
Yeah, they're
and they
doing
say, why do
yoga,
I
they're-
need it? I said, because you might live 20 more years or
Right.
15 more years. And
In good
you know,
conditions. Yes.
Exactly.
Yeah.
And if you have a little lump, that they take it out and that's it. But to die of breast cancer is horrible.
It's an ugly way to go.
I
And when those
know.
recommendations were given, we were not living to 90s, 100s. We were living to 75, maybe 80. So the thought process is if you detect a breast cancer at 75, you're going to die anyway. So why
so
do that? But now as we're living longer, as Marilena said,
Yeah. Wow.
So relevant, yeah.
So please go get screened, go get checked, go get, especially if you're, what you guys said, over 30, no, 40, 30, go see your
Over
primary
40,
health physician.
40.
But it's so
Without a
important. We were
family
ping
history.
for it because it could be preventable if it's detected early. So thank you for joining us.
Thank
Thank
you.
the ladies, the
you.
beautiful ladies with their fabulous fashion. And if there's anything that you would like to see us talk about or any questions that you have for any of us, the doctors, of course, but or Karina or I, please put them in the comments and we'll see you on the next show.
Bye.